Hello and good morning everyone. Welcome to our presentation video by Group 4. The member of presenters involving Christy Uyang John, Nur Diana binti Mat Hassan, Anis Farzana binti Ahmad Jamaidi, and Nur Farahani binti Abdurrahman. Hello everyone, I'm Nur Diana. So let me brief you regarding MOH. What is MOH? MOH stands for Ministry of Health owned by the Government of Malaysia. As you can see in the slide, there is Ministry of Health's logo that includes of their motto and core values. The motto of Kami Sedia Membantu and the values of loving, professionalism and teamwork have been the principle for the agency to keep on going towards achieving their goals. Before that, the Government of Malaysia having Ministry of Health in order to take in charge for the health system of the country to reach the standard level. As we know, YB Khairi Jamaluddin and Dr. Nur Hisham are the two powerful people involved in the Ministry of Health Malaysia.
The function of MOH is improve and maintain the quality of health by providing efficient and effective health services. As we know, community more prefer private hospital more than government hospital because of their services. Next, as informants of the birth and death occurrence, MOH is all-in-one, which is since our life were relatable with the agency start from the beginning of birth to the end of life. Health information records collected in every health facility are important for statistical analysis. Health information record is vital for health specialists in diagnosing their patients' health progress from time to time.
The responsibility of MOH include ensuring the quality and access to healthcare service. For instance, MOH is one of the Malaysian government that involved in the MySejahtera system application. The community can easily update health status and keep in touch with the latest info. MOH also providing online service for communities convenience so that they can easily access for education and complaints regarding health issue. Secondly, MOH also take responsibility in joining hand with MITI and MKN for the country's economic strength during COVID-19 pandemic. For instance, MOH creates collaboration between Malaysian international trade and industry regarding standard operating procedure. Furthermore, collaboration between MOH and MKN by spreading safety awareness through SMS. MOH responsible for giving treatment on the communicable disease and non-communicable disease. Communicable disease is the type of infectious disease such as COVID-19, HIV and tuberculosis. This type of disease might need special treatment and requiring special while handling the patient. Non-communicable disease is the type of non-infectious disease such as cardiovascular, cancer and diabetes. Even so, this type of disease might need repeated appointments in order to monitor the patient's health status.
MOH has the authority in monitoring health and cosmetic products in the marketplace from the manufacturing process until the supply process. MOH has the authority to give recognition or approval to health and beauty products before they are marketed. MOH also has the power to withdraw the approval given if it is found that the product sold contains dangerous substances. Second, MOH has the authority to set standard operating procedures SOP in order to control the spread of infectious disease such as COVID-19. The authorities impose a compound on anyone who fails to comply with their prescribed SOPs, not wearing a face mask, failing to maintain physical imprisonment and not registering through the MySejahtera application, or recording personal details when entering the premises, which will incur a compound of 1,500 ringgit. Third, MOH has the power to require food product operators to undergo food handler training courses, LPM. This action is to prevent and control food poisoning diseases caused by the failure of the food premises to maintain hygiene and ethics in food management. This is an example of a certificate provided by the Ministry of Health MOH based on the field observation made at each food establishment, such as cafeteria. According to hygiene, the food hygiene rating certificate has 4 grades, which is A, B, C and D. Here is an example of how to break the COVID-19 chain by avoiding crowded places, confined spaces and close conversation. Furthermore, the registration and licensing system consumer may always verify their products to ensure the quality, efficiency and safety of pharmaceuticals. There are also Malaysia laws regarding the Prevention and Control of Infectious Disease Act 1988.
MOH is one of the government agencies that successfully applying an ethical principles while performing their duties. MOH is caring by providing services in fully responsive, friendly, and courtesy. In terms of professionalism, MOH provide the best services include ethics and standard of work. And as for the teamwork, MOH is working as one team to achieve the same goal.